The Center for Independent Living, it is an organization here that helps thousands of people every year. This year, they're doing something a little bit different. You know, it is open enrollment for Medicare, for your health insurance. It can be a little confusing at times, and we want to help. Ellos quieren ayudar a nuestra comunidad. We've got Victoria Morales and Megan Jackson with the Center for Independent Living, which, by the way, is called CB-CIL now, and it's short for Center for Independent Living. So, ladies, first, can you tell our viewers a little bit about what CB-CIL provides here in our community?
CB-CIL works with individuals to achieve their goals, whether accessing assistive technology, transportation. We also have hearing aids. We have a program that we can help with hearing aids, with prosthetics. We have relocation services. We have transportation. We help people if they have like a doctor's appointment. We can help them, even though if they're in rural areas, we can help them go into their doctor's appointments. We also have temporary rental assistance. It's another one, and we have our class program. Nosotros somos CB-CIL, somos una asociación no lucrativa que ayudamos a gentes con discapacidades. Tenemos varios programas gratuitos, entre ellos el que reubica a las personas de asilos a sus casas. También tenemos otro programa que ayuda con aparatos auditivos, con prótesis. También tenemos otro programa que ayuda con asistencia de renta temporal, con transportación, ayuda a la gente a poder ir a sus citas con el doctor, aunque vivan en zonas rurales. Y claro, tenemos nuestro servicio de navegadores gratuitos que pueden ayudar a encontrar un servicio médico accesible para usted.
Servicios navegadores, that's important, especially right now. This time of year, of course, as I mentioned at the top of this interview, that it is open enrollment time. Again, a little confusing, but I understand you offer a free service. Tell us about that.
The Navigator program, we assist with marketplace health insurance, and it is a free and confidential service and unbiased. We can help with the marketplace application, Medicaid applications, SNAP applications, and then also if somebody is needing like a clinic card, we can help with that as well. And again, we're just there to assist through the process and provide that education on those choices so that the community can make the best financial decision for their health insurance. You know, since it is affordable health insurance, we just want to make sure that they're making the best decision for their household.
Tenemos nuestro servicio de navegador gratuitos. Tenemos navegadores que están disponibles para que puedan tener, puedan escoger un plan accesible para la persona. Les damos varias opciones, les damos educación acerca de cómo escoger un plan médico que sea bueno para la persona. No tenemos ningún tipo de relación con ninguna compañía médica, somos completamente independientes y lo que queremos es darle las opciones para que tengan un seguro médico que sea accesible económicamente y también que sea algo bueno para su seguro médico.
You know, see, that's great to know because the Center for Independent Living is doing this to help our community get through this interesting period of time where we know that if you're dependent on Medicare or Medicaid, you need to know how to be able to select the right plan for you. So how is the Center for Independent Living able to give this service to the public?
We are a nonprofit, so we aren't taking payments from anybody. We are only providing this free service so that people can make the best decision. So we're not affiliated with a doctor. We're not affiliated with an insurance company. We are not here to sway one way or the other, just to simply go through the options, go through the application, and give the best. If they have questions, answer questions. There's a statistic that says that 4 out of 10 people would not have gotten insurance if they hadn't had the assistance. So it's a very important service that we provide because there are some people that would not have insurance if the service was not there.
Nosotros no estamos afiliados con ningún doctor, con ningún seguro médico. Nuestros servicios son completamente gratuitos podemos ayudarles a tener un seguro médico accesible para usted. Hay una estadística que dice 4 de 10 personas no hubieran podido inscribirse a un seguro médico si no hubieran recibido la asistencia de los navegadores que puedan permitir que ver la accesibilidad de un seguro médico.
Okay, I know some folks at home may not have a pencil or paper ready again, so let's find out. Once again, how can people needing help reach out to you guys over at your organization?
We are located at 3833 South Staples Street. That's our office, Park South office, or location, I'm sorry. And we are open from 8 to 5, but we are also open for extended hours during open enrollment from 5 to 7 on Tuesdays and Thursdays. And then we're also open on Saturdays from 9 to 2. And we there's a scheduling tool on our website. You can just go onto our website into the health insurance navigator section of our website, and there's a scheduling tool, and any individual can just go in there and schedule their appointment themselves, or call our office at 883-361-883-8461 and set up an appointment that way. We're also accepting walk-ins at this time. We have navigators available that speak English and Spanish. And then we also have access to translators for other languages as well.
Sí, estamos ubicados en 3833 South Staples Street, Suite N110. Estamos abiertos de lunes a viernes de 8 a 5, los martes y jueves hasta las 7 de la noche. Los sábados de 9 a 2 de la tarde. También pueden hablar a nuestro teléfono 361-883-8461. También pueden visitar nuestra página web, CB-CIL.org. En esta tenemos una herramienta para poder hacer sus citas en línea y ya de ahí pueden llegar a nuestra oficina para poderles hacer su plan médico, ayudarles a escoger su plan médico y ya es todo. Yeah.
Yeah. And then also if the schedule that we have, the extended hours that we have don't fit the individual's their schedule, then we can also stay after hours other days as well. We do our best to accommodate the consumers.
And that right there is key. I know that Victoria and Megan, you've given us a lot of information to ingest, and we appreciate you guys coming on Domingo Live. But before we let you go, any final points that you want to make?
Yes, so I also wanted to add, so we're in the open enrollment period. It started on November 1st and it ends on January 15th. And there is a, to get coverage by January 1st, you would need to enroll by December 15th. So the open enrollment goes through January 15th, but in order to get coverage for January 1st for the first of the year, you would need to enroll by December 15th.
Sí, muy bien. Nuestro programa va a correr hasta enero 15. Para poder tener un seguro médico para el 1 de enero se tienen que inscribir para el 15 de diciembre. Es muy importante, por favor, que si están interesados en tener un servicio médico para el 1 de enero, que se inscriban antes del 15 de diciembre.
The Navigator program is available for anybody regardless of a disability. So while CB-CIL does service individuals with disabilities, the Navigator program assists all individuals of the community.
Solo para aclarar, aunque nuestra asociación ayuda a gente con discapacidades, nuestro servicio de navegadores para todas las personas de todas las edades.
Lots of information. Victoria and Megan, thank you so much from the Center for Independent Living, from CB-CIL, for giving us that information and passing it along to our friends and neighbors who are watching us all across the coastal bend.